Join me as I dive into the most common nursing pitfalls that new moms face and see if I can navigate them without making any mistakes. In this video, you'll learn about the common nursing pitfalls that new moms often encounter and how to avoid them for a smoother breastfeeding experience. When it comes to starting their nursing journey, many new moms face a range of challenges that can leave them feeling frustrated, anxious, and unsure of what to do next. One of the most common issues is latching difficulties. It can be really tough to get that perfect latch, and it's not uncommon for moms to feel like they're doing something wrong. Another challenge is ensuring an adequate milk supply. It's natural to wonder if you're producing enough milk for your little one, and it can be stressful if you're not seeing the results you want. These challenges can be overwhelming, especially when you're already dealing with the emotional and physical changes that come with having a new baby. Many moms feel like they're failing or that their body is somehow broken, and it can be really hard to know where to turn for help. It's not just latching and milk supply either. There are plenty of other issues that can pop up, from nipple soreness to engorgement, and it can be really tough to know how to navigate them all. The truth is, most new moms face some kind of challenge when it comes to breastfeeding. It's not just you. But despite how common these issues are, it can be really isolating and lonely, especially if you're not surrounded by a supportive community or knowledgeable healthcare providers. That's why it's so important to be aware of these potential pitfalls and to know where to turn for help when you need it. In the next few minutes, we're going to dive deeper into each of these challenges, and I'll be sharing some helpful tips and expert advice on how to combat them effectively. Whether you're a brand new mom or just looking for some extra support, I hope you'll find this video really valuable. One of the most common latching issues is a shallow latch, which can cause nipple soreness and make feeding uncomfortable for both mom and baby. The good news is that this is often an easy fix. Try adjusting your baby's position, making sure their mouth is wide open, and getting them to latch on at the areola rather than just the nipple. You can also try using a nipple shield or working with a lactation consultant to get that perfect latch. Another common issue is engorgement, which can be really painful and uncomfortable. One of the best ways to deal with engorgement is to make sure you're expressing regularly. This will help relieve pressure and discomfort, and can even help stimulate milk production. You can also try using cold compresses or warm washcloths to help ease the pain, and consider taking a pain reliever if things get really bad. Milk supply can be a real worry for many new moms, especially in those early days when you're not sure if your baby is getting enough. The good news is that your milk supply will regulate itself over time, but in the meantime, there are plenty of things you can do to support it. Make sure you're drinking plenty of water, eating nutrient-rich foods, and getting enough rest. All of these things can help boost your milk production. You can also try using a breast pump to express any excess milk, or working with a lactation consultant to identify any underlying issues. One of the most powerful stories I've heard is from a mom who was struggling with a low milk supply. She was convinced that she just wasn't cut out for breastfeeding, and was considering switching to formula. But with the help of a lactation consultant and some persistence, she was able to increase her milk supply and go on to breastfeed her baby for over a year. It's stories like these that remind us of the importance of seeking help when we need it, and not giving up on our breastfeeding journey. I want to share a story that really resonated with me. A mom who was struggling to get her baby to latch, and was feeling like a total failure as a result. She reached out to a lactation consultant and discovered that her baby had a tongue tie, which was making latching impossible. With a simple procedure to release the tongue tie, this mom was able to get her baby latched and feeding happily. It was a total game changer. Stories like these remind us that breastfeeding is a journey, and that it's okay to ask for help when we need it. One of the most important things I want to leave you with is that it's okay to not have all the answers. Breastfeeding can be tough, and it's normal to encounter setbacks along the way. But with the right support and resources, you can overcome these challenges and go on to have a successful, fulfilling breastfeeding experience. Don't be afraid to reach out for help when you need it, whether it's a lactation consultant, a breastfeeding support group, or just a friend who's been through something similar. In this video, we've covered some of the most common nursing pitfalls that new moms face, and explored some helpful tips and expert advice on how to combat them effectively. Remember, awareness and preparation are key when it comes to breastfeeding. Don't be afraid to do your research, ask for help when you need it, and surround yourself with a supportive community. Thanks for watching, and don't forget to share your own experiences in the comments below. If you're looking for more parenting tips and support, be sure to check out my other videos and subscribe to my channel for regular updates.